Hello, I'm Gemma, and during today's presentation I'll be discussing the perioperative nurse's role in relation to radiation exposure of patients and healthcare workers during procedures in the perioperative environment. I'll be discussing radiation exposure and how perioperative nurses prevent unnecessary contact, as well as how they promote radiation safety. According to the Australian Nuclear Science and Technology Organisation 2016, radiation is energy or particles that are able to travel through space or other mediums causing ionisation. There are many different reasons as to why patients may need exposure to radiation, and these include therapeutic purposes such as cancer treatment and diagnostic and interventional purposes such as X-rays. According to Weirbeck 2009, radiation is used predominantly to produce good outcomes. However, that does have the potential to cause adverse health outcomes such as higher predisposition to certain cancers. So it is absolutely vital for a perioperative nurse to prevent or limit this exposure, as well as promote safety surrounding radiation. According to Radiation Protection in Diagnostic and Interventional Radiology Safety Guide 2008, diagnostic and interventional radiation is used in many forms. However, the most common is radiography, which is also known as an X-ray. An X-ray exam consists of small amounts of radiation through the body to form an image, which is then interpreted by a radiologist. Having small amounts of radiation may not sound like cause for concern, but it can cause potentially life-threatening outcomes. This is why it is vital for perioperative nurses to be strict when it comes to safety, to avoid radiation exposure to themselves and other healthcare workers, and to minimise the radiation exposure to the patient. According to Phillips and Monahan 2011, there are 3 simple yet effective ways a perioperative nurse can keep radiation exposure as low as reasonably possible. These include the time spent near the source of the radiation to be kept to a minimum. This includes X-ray beams to be kept on for the shortest amount of time possible, the distance from the radiation source and people, and radiation shielding using lead equipment which is designed to protect patients and healthcare workers from radiation, as well as shielded rooms for the perioperative team to stand within away from radiation exposure. As well as those, the Radiation Protection in Diagnostic and Interventional Radiology Safety Guide 2008 also states that the role of the perioperative nurse is to provide the following: correct identification of the patient and whether the patient could be pregnant, as radiation can cause defects, education on the procedure to patients, carers or guardians on ionising risks, have a sound knowledge base themselves on the equipment and what it is used for and how to use it safely, and to ensure all radiation machines are turned off when not in use. There are also therapeutic treatments which, according to the Cancer Council Victoria 2014, admit high energy radiation waves that can destroy or damage cancerous cells, which is why it is used predominantly to treat cancer either alone or in conjunction with other treatments. According to a report by Demir et al. 2016, as this type of treatment is high energy, there are many more important safety precautions that need to be followed and implemented by a perioperative nurse to avoid radiation contamination, such as what I've listed above previously, as well as thick lead gloves when in contact with bodily fluid, washing of hands thoroughly after contact with potentially contaminated materials, and a special hazardous waste bins for bodily contaminated waste. Ultimately, the role of the perioperative nurse is preventing radiation exposure and promoting radiation safety is crucial, whether it be during therapeutic, diagnostic or interventional radiation treatments. Thanks.